All right, here we are. This is the start of our chat as part of Help Heal Hope Suicide Prevention Week conversation. This one joined by my wonderful colleagues Brittany and Autumn. You two have been doing a lot of incredible work on the Green Bandana Project, and I, Josie Jurizic, Marketing and Communications Manager for SAVE, am very excited to chat with you about what all you've been up to and how this program is impacting students and young adults in the U.S.
Great. We're happy to be here. Thank you, Josie.
Yeah, Brittany and
thank you.
Autumn, do you just want to get into it and kind of introduce yourselves and your background, and then we can kind of talk about the program?
Yeah, that sounds great.
Sounds great.
Do you want me to
Go
start?
ahead, Autumn.
Sure. So I'm Autumn Lemieux. I'm the outreach coordinator for the Green Bandana Project and AmeriCorps Vista. That just means that I'm serving for a year at SAVE in a capacity building role. But my work is, as I said, on the Green Bandana Project. I'm really passionate about youth advocacy and education. My background is also in education. My major was at Winona State University in applied linguistics, and a minor in teaching English to speakers of other languages. And I love applying all of those skills to my work at SAVE in helping prevent suicide for young adults. Brittany, do you want me to pass it over to you?
Yeah, great. Thank you, Autumn. My name is Brittany Sensor. My background is in mental health. My current role at SAVE is Director of Education and Training. I have been supporting Autumn and their effort on the Green Bandana Project, which I'm super excited to talk about today. And the rest of the SAVE team who have worked so diligently and hard on getting this the Green Bandana up and running. I am from Minneapolis, Minnesota. Again, like I said, my background is in mental health. I started working within the suicide prevention arena, would I say, after I lost my child, my only child, Aria Joy, to suicide in 2019. She was 13 years old. And so I am super excited to be a part of a program like the Green Bandana Project, where we are bringing mental health programs and resources to students. So I'm excited to talk about that today.
Yeah, thanks so much. So tell me a little bit more about what the Green Bandana Project is, and kind of a use case, like in what circumstance does a student maybe needing resources access the Green Bandana Project, or how do you get involved? Tell me more.
Yeah, I mean, so the Green Bandana Project is a school-based program that increases students' awareness of mental health and suicide prevention resources and their ability to seek support before and during a mental crisis. There are a lot of answers to your question. How students get involved is really about how the institution is connected with us at SAVE and within the Green Bandana Project. And as we talk a little bit more, we can give a little bit more information about what it looks like for a student to be a part of this and to adapt the Green Bandana Project within an institution.
So what kind of school or student is the Green Bandana Project serving? Like what are some needs that a student might notice within their school environment, and what might kind of prompt them to start a chapter at their campus?
Yeah, so we're super excited about the Green Bandana Project because what we know is that students are alarmingly affected by mental health, right? And suicide is the third leading cause of death for young people ages 15 to 24. And this statistic underscores the urgency of addressing mental health in this particular dynamic, right? So young people are vulnerable to the pressures that can lead to mental health crises, and without adequate support and resources, they may struggle to cope with overwhelming emotions. They experience, stigma around mental health issues that often prevent students from seeking help. So the Green Bandana Project is really a bridge from students that feel like they don't know who to ask and how to get help. And then the Green Bandana ends up being a visual representation of, hey, it's okay to ask for help. And that's the ultimate goal of what the Green Bandana represents.
Yeah, and just adding on to that, I think campuses that I find are particularly motivated to join the Green Bandana Project, there's a student or a group of students typically that have noticed within their community that they're wanting to start more conversations, or they're ready to have more conversations about mental health. They're ready to get resources out there. They're ready to just really kick up that awareness piece that I think some communities are still in need of when it comes to, getting the word out of what really is around. Because often we're finding that there's so many resources that could be utilized that people aren't utilizing because they're not aware of them. And that's one of our major goals with the Green Bandana Project, is to help connect students to those resources that they need.
Yeah, there's some study findings that show students and young adults are much more likely to approach a peer first for help, right? In a mental health crisis. Can you speak on that at all?
Yeah, so what we found from a Healthy Mind study is that there is this fear of stigma, right, of asking for help. However, students, 94% of college students don't think differently from a student that may ask a peer for help, right? So we're trying to bridge that gap of, hey, and using that Green Bandana as a visual representation that it's okay to talk about your mental health needs. And yeah, that's what the Green Bandana role is to really create that conversation piece.
Yeah, so much of this I think is about community building and just kind of fostering those conversations, right? Like creating a platform, I guess, for students to kind of approach each other and maybe learn some tools and get some language to help facilitate these kind of really organic conversations on campuses. Autumn,
Yeah.
you had kind of a personal experience with the Green Bandana Project, correct?
Yeah, that is correct. Actually, when I was still a student at Winona State University, we had an iteration of the Green Bandana Project there on campus, and I was struggling personally and wasn't sure how to get the help that I needed, but I had recalled asking my classmate what the green bandana on her bag had meant, and weeks later, I ended up reaching out to that same classmate to ask for help and get some resources to get me out of that unsafe household situation that I was living in. And if I hadn't done that, I don't know what the rest of my education would have looked like, if I would have graduated on time or even made it to this role at SAVE when I did. So I'm so incredibly grateful for the students that were on my campus that were ready to take on that role to get others connected to resources. And I'm grateful that there were people on campus ready to help me with the things that I needed help with. And I think that's just another part that makes me believe so strongly in this program, is because I've felt its impacts personally.
Yeah, that's amazing. I mean, an excellent perspective that you offer as an organizer of this program, and I mean, I think it just goes to show like the power of reducing stigma and just enabling those conversations. I mean, it really does make an impact.
Yeah, I agree. I mean, tied up with that stigma is just so much fear. And I mean, that's so much what I was feeling then, just fear of my situation and fear and distrust of the people around me. And, just having another access point besides, going to perhaps one of my faculty or professors on campus. I mean, that was the difference for sure.
Hmm. Well, and I think that peer-to-peer support is so huge. Like, you're not escalating the situation necessarily. You're simply having a conversation with your friend or a fellow student, someone really relatable to you. And that just is such a good, access point for students. And I think that fostering of access is so huge. Like for someone in crisis, I think that feeling of being stuck and just kind of unclear on where to go next is, probably one of the weightiest pieces of their experience.
Mm-hmm. Yeah. So currently the model for the Green Bandana Project from where we're at is to create an outreach program where we're reaching out to institutions and having conversations about what the Green Bandana is, why it's important, right? That stigma piece, that peer-to-peer portion of connection, and also that fighting stigma aspect as well. And so with each organization or with each institution that we have relationships with, there are certain expectations from leads, from the Green Bandana leads, and then also student members. And each student member that is a part of the Green Bandana Project is expected to complete a gatekeeper training, which is a suicide prevention training, along with an orientation. And with that training, after they complete that training and that orientation, they receive their Green Bandana. And their Green Bandana, along with resource cards, is a symbol of, hey, I am a peer that is safe, knows what my school resources are. I have an understanding of what my community resources are. And if you're in need of crisis intervention, I have information on how to help you with that as well.
So as part of that training, I know there are some language components, like advising, students what kind of language to use when they're interacting with a peer in need. Obviously other components as well. Can you kind of get into what that training looks like and maybe what some of the recommendations are for students as they embark on this journey of becoming a Green Bandana certified peer?
Yeah, so for our orientation, we go over a number of things. Our very first objective is to go over the scope of their role, the limitations of what they, can and cannot do as a Green Bandana member. We really want to make it extremely clear what the expectations are, so students aren't, putting further expectations on themselves than necessary. As well as they know what they are there for, and what things that they are empowered to do. Some other things that we offer within that training are engagement skills. So along with, recommended things to say, we've got some other recommendations for ways to interact with a peer that approaches them. Within that as well, we do recommend that members wait for a peer to approach them, opposed to reaching out to a peer directly, just to keep those interactions organic and comfortable for everyone involved. But yeah, that's just a little overview. Brittani, did you have anything else to comment on like the QPR or gatekeeper training side?
Yeah, so the expectation for each student that is a Green Bandana member is that they complete that orientation, where they understand about what it means to be a Green Bandana member. We've created in the last 3 or 4 months, we've created this upgrade of what we are presenting to institutions, full access to an LMS network, which is, it's called Mighty. It's the TGBP Mighty network. But if you're not familiar with Mighty, maybe you're familiar with D2L or Blackboard, where it gives a instructor access and then also a student access. And within that space, there's conversation. There's this space where leads and students can create a community between the Green Bandana members, and access for students is that orientation piece which Autumn has been talking about. We go into depth a little bit about what meeting a student looks like. It's meeting with them and speaking with them from a non-judgmental space, coming with empathy, active listening, and giving a little bit more details of what it looks like to meet a peer who might need help. And then the QPR training is a suicide gatekeeper training, which is a suicide prevention training. It's about 60 minutes. And the goal in that is helping students. It's never going to be a really easy conversation to have. It's not easy for me. My background is in mental health. It's not easy for anyone really to ask someone, are you thinking about killing yourself? But it is the beginning of a conversation on how we view prevention and how we get to the goal of the Green Bandana Project, which is saving people from suicide. So having those bold conversations, asking those really important questions, those are the type of skills that you will get from that QPR training. And that's from a student side. What we are also offering is that with each school that is partnering with SAVE and with the Green Bandana Project, is we're offering a instructor training as well, so that each school has the option to teach not just their students, but if they're like, hey, we're noticing that this is becoming more of an issue than we ever thought, you can teach your staff, your faculty, you can put it in your orientation. So the instructor training that is offered through the Green Bandana Project is really giving permission for that specific instructor to use it how they see fit within their institution.
Yeah, that's awesome. And I think it's so important to normalize asking that question. Are you thinking of suicide? Are you thinking of killing yourself? It's such a foreign and strange thing, I think, for people to say or get used to saying, just because of the stigma attached to it. But there's obviously such value in having those really bold, brave conversations, because that's where we can start pointing people in the right direction, right? That's where we can start normalizing those feelings within ourselves and within our communities, and just tackling it, really head on versus brushing it under the rug. So what do you think is the value here for, students and faculty and everyone else? I mean, in terms of this being kind of a means of activating, a campus for the good of mental health? Like, obviously there are some organizational components here. What are some of the things beyond just being available as a resource to other students, that other, peers and student leads might be able to do? Are there events or other things they could kind of organize related to the Green Bandana Project, or is this strictly, an independent conversation based kind of thing?
Thankfully, we provide a lot of prompts and ideas for schools to take the Green Bandana Project further, especially in its promotion among campus. We're really encouraging schools to get their students involved in making posters, hold some art contests, bring in some speakers on mental health topics from experts in your area if you can. We give them a guide to make their own designs for the Green Bandana Project on Canva, so they have the right colors and fonts and graphics to make similar content. We would really love to see students continue, as they have been, to take this program and make it their own on their campuses, within the safe messaging that we would like everyone to follow. But we really love seeing campuses that are more active in the Green Bandana Project than just signing up those student members and staying in contact. The campuses that we hear going above and beyond, the students are saying that they feel empowered, they feel a strengthened connection to their peers, they feel more capable in their ability to seek help, as well as their ability to help others find help. Just all of the student feedback all around on those campuses, especially that are doing a good job of those extra activities. Would love to see more schools doing that.
Mm-hmm. And we are noticing the impact of the Green Bandana Project, right? So this started in 2014. It was initiated by Dr. Betsy Gerbeck in honor of her son, who died by suicide. And his statement was wearing this green bandana. And her goal with the green bandana was to create this peer space for students at River Falls. And then after 2014, it was adapted by Wisconsin-Madison, and it just has continued to grow until SAVE took it over. So SAVE Us, right? So Suicide Awareness Voices of Education in 2022. And we are now in over 40 schools within 17 states. And what we are noticing, because Autumn and I have many conversations with many schools throughout the nation, is that this is very needed, right? Like, schools are looking for a program that is so incredibly visual, like a green bandana, that shows like, hey, someone has resources for you, and it's okay to ask for help. So we get lots of inquiries, and they just continue to grow and proliferate through active outreach, and through the website at the Green Bandana Project. I mean, we're super excited, and hopefully our plan is to get this to as many schools within the nation as we possibly can. And we're noticing a need. We're hearing it from schools. We're hearing it from students. And, it's our goal to meet those schools and those students where they're at with this incredible mental health initiative.
Yeah, that's really incredible, the broad reach that the Green Bandana Project has so far, and it's certainly continuing to grow, and for good reason. I mean, what are some of the things that you kind of hear in your conversations with schools or student leads? What are some of those specific challenges that students and young people are facing today that may be unique to them, or, you know, very long standing as a young person in America? What do you hear?
I hear over, I'm so sorry, Brittany.
Go
I
ahead,
can
Adam.
let
You're
you
good.
speak. Okay. I hear over and over, especially from students and leads, just feeling unseen and unheard, especially you know, in mental wellness. It seems like they don't have you know, as much support as maybe they wish they did, whether that be from their friends or their communities. And it sounds like the Green Bandana Project for many of them has offered, you know, a way to be seen and a way to start building that network of support. You know, both like visibly when you see green bandanas all over campus, it's a constant reminder that there are those people there that are part of this too, that you might think wouldn't be otherwise. And I think giving students a chance to have a voice and to like build this themselves or build this in collaboration with their faculty member at their institutions is really big. I think it's really empowering.
And what we know about students today, right, is that they're navigating complex and overwhelming reality of challenges that can significantly impact their mental health. Academic pressures, social pressures, including a desire to fit in, which is why a green bandana can be so empowering, right? Maintaining relationships, and there's so much complexity when it comes to figuring out who someone is, their identity, during those formative years. And, you know, alarmingly, with all of that, we know that suicide is the third leading cause of death, ages 15 to 24. So how do we meet students where they're at? And I think that the Green Bandana Project is an incredible resource for giving students the power to intervene and say, this is how I show up, not just for myself, but for other people.
Yeah, it's a very grassroots, I think, cool kind of entry level thing that, you know, that a student can just kind of pick up and apply on campus and really throughout their whole lives, right? So I guess as we kind of conclude this conversation, what are some, I mean, takeaways from the Green Bandana Project that maybe all of us, student or, you know, senior or middle-aged person, people from all walks of life, what can we be doing, I guess, not only for the young people in our lives, what can we be communicating to them or representing to them to indicate that we're safe and approachable? And, you know, what can we be doing just within our own communities all over the place? What are those kind of easy, simple human things we can be doing to support one another?
I can. Do you want me to start, Adam?
Yeah,
I have
please.
no problem starting. You know, with it being National Suicide Prevention Week, it's really important to remind ourselves that we all have the power to help others and to ask those questions and meet others where they're at, and having conversations with not just the ones that you feel are maybe struggling, but having conversations with people who are the funny ones or the ones that seem like they have their life pulled together. We all need kindness and someone to care in our lives. It's a human need, a basic human need. And I hope that we can continue with the Green Bandana Project to model that, that there are people out there that are willing to meet you where you're at, but then also support the people, support individuals, right? So that they know that there are people out there. If you're not someone that can necessarily be a part of the Green Bandana Project, that you know that there are people out there that are willing to help if you need. So I'm super excited to bring this model to schools and see where that goes from there. But my hope is that people take from this conversation is that there are people out there that are willing to help need be.
Certainly, and just one little thing to add on to that, I think the biggest thing anyone can do is just continue to talk about mental health and mental illness. We make so many assumptions, especially when we're scared, and I see that a lot, especially in mental health. So I think just having that ability to say, like, hey, I'm here with an open mind and I'm ready to hear what you have to say and I'm ready to talk also goes a long way.
Yeah, holding space, and I think modeling too, like answering the question, how are you, with the finest honesty you can spare, I think can go a long way as well. Like, let's just be open and let's normalize having hard days and figuring it out together, right?
And asking hard questions, right?
Yeah, totally.
We've brought that up, and it's not just the first time. I've watched a lot of these conversations that we've had this week. It is a hard question to ask, and normalizing that conversation of, are you thinking about suicide? Have you thought about killing yourself? It's a very, very important question to ask.
All right. Well, thanks so much, Brittany and Autumn. You've shared a lot of important information about this very cool program for students. It's available to high school and college students, and you can learn more at the greenbandanaproject.org. Stay tuned for more Help, Heal, Hope Suicide Prevention Week conversations, and thanks for tuning in.
Thanks,
right,
Josie. Thanks, Autumn.
Thanks.
Bye.
Bye.